Hey everyone, this is Dr. Sorin here. I'm board certified anesthesiologist and pain management specialist. So I want to cover a topic that's uncomfortable. A lot of people don't want to talk about, which is what do you do when you get discharged from a pain clinic? So I want to cover this in two sections. One, why somebody would get discharged, and number two, what you can do to avoid being discharged from a clinic. So let's go over it. Why do people get discharged from pain clinics? Well, probably the most common issue, number one, is non-compliance. That means you and your doctor, you set a treatment plan and then you don't follow it, which means you may take more medicine, so self-increasing, taking medications that weren't prescribed to you, mixing it with medications you're not supposed to. So those are kind of non-compliance. You are not following the treatment protocol. And by the way, that puts the provider in a really tough position, because if you tell somebody, you make an agreement, and now all of a sudden they're taking medicines and you say, hey, please don't do that because it's dangerous, you could hurt yourself. Well, at some point the provider is going to draw a line and say, hey, we've given you several chances here. You obviously don't want to follow the program, and they're going to discharge the patient, which is really sad and heartbreaking at times, but you need compliance. It needs to be a two-way street. Number two reason, behavioral issues. Now this can mean a lot of things, but sometimes this can mean like threatening behavior to staff, being very rude to staff. So again, we run a clinic and we have a tight-knit team. And so when somebody's really rude or disrespectful to our team, it's disrespectful to everybody in the team. And so that is oftentimes a reason for discharge. Number three, missed appointments, especially with Schedule II narcotic medications. You need to keep those appointments. Those appointments are a big deal. And so if somebody misses appointments and has multiple excuses why they weren't there, that really puts the provider in a very tough position, especially med legally with the DA and everybody looking at medication management and putting a big magnifying glass on it. So it's very important for your doctor to have everything documented. So that's another important reason. And number four, drug-seeking behavior. Again, this is not a comfortable word. It's not a comfortable topic to discuss, but really when somebody is very specific and they just want their drugs and they don't want to consider anything else, it makes the provider and it makes it seem like they're not interested in solving their problem. They're just more interested in getting these specific drugs. And obviously that can be linked to people that want to sell their medications or other things. So it really raises a lot of red flags. So come in to your provider with an open mind and saying, hey, I want to get better. I'm willing to try these different options, and I think you'll get the best results. So what are 4 tips for avoiding getting discharged? Number one, probably the most important one, which is open communication. This is important in all our relationships, but I tell patients, look, it's a two-way street, right? We got to be there for you and do our best to take care of you. And when you have an issue, we want to be there for you. But on the other hand, the patient needs to be open with us and tell us, hey, I'm having a problem, or this just really isn't working, or I'm having a side effect. But there needs to be that communication. So just coming in at the appointment time saying, hey, I decided on my own to double my medication and I did this and I did that, that is not good communication. So number two, adherence to the treatment plan. So if you and your doctor create a treatment plan, you need to adhere to it. And again, going back to number one, if it's not working, you need to communicate that with your provider. Number three, behavioral etiquette. This is what we talked about earlier, not being rude to the staff and being respectful, kind, courteous. This is just common courtesy to the medical staff. We have employees and they work here. They need to feel safe and they need to feel appreciated. And so that's very important to the staff in getting the best results. And number four, I think is an important one, which is educate yourself. If you have a medical condition and you educate yourself, I love it when patients are doing their own research, they're reading about their condition, and therefore we can have a more educated discussion on it and we can be very realistic about what's going to work and not going to work. So hopefully those 4 tips will help you have a better visit and not run into the issues where you put the provider in a very uncomfortable position where they have to discharge somebody. Thanks a lot for watching. See you on the next one.